Have you ever stopped to think about the risks of avian flu spreading in the United States and how it could directly affect your health and well-being? Today, we're going to delve into this crucial topic, avian flu, and its potential impacts on us, humans. This video is not just informative, it's an essential tool for you to understand the dangers and take preventive measures. Imagine what it would mean to be aware of the symptoms and necessary precautions to protect yourself and your family. By watching this video, you'll be equipped with valuable knowledge that can make all the difference. Have you wondered if avian flu could become a pandemic? How to identify early symptoms? And most importantly, how to prevent it? Don't miss the opportunity to educate yourself on this current and relevant issue. I invite you to stay with us until the end to discover how to protect yourself and what to expect in the face of this potential threat. Let's explore these questions straightforwardly and practically. After all, information is the best defense. What is bird flu? Avian flu, also known as avian influenza, is a highly contagious viral disease that primarily affects birds, including chickens, ducks, and other wild birds. The virus responsible for avian flu belongs to the Orthomyxoviridae family and is classified into different subtypes such as H5N1, H7N9, among others. These subtypes can vary in their pathogenicity and ability to infect different bird species and, in some cases, mammals, including humans. Avian flu has historically been associated with outbreaks in domestic and wild birds in various parts of the world, first identified in birds in the United States in the 1920s. Since then, various subtypes of avian flu viruses have been detected in migratory birds, poultry, and other animal species in the U.S. Infection in birds can range from mild to severe, with symptoms such as lethargy, respiratory problems, diarrhea, and death in severe cases. Different types of avian flu viruses, such as H5N1 and H7N9, are known for their ability to infect humans in rare cases, but with significant lethal potential. Transmission to humans usually occurs through direct contact with infected birds, their feces or secretions, or through the consumption of undercooked meat from contaminated birds. While human risks to humans. Avian flu in the U.S. has been under constant surveillance by public health and agriculture authorities due to its potential impact on animal and human health. Control and prevention measures include constant monitoring of birds, restrictions on the import of live birds and poultry products, and public education about the risks associated with avian flu and the hygiene measures necessary to reduce the risk of transmission to humans. Understanding avian flu and its different subtypes is crucial to mitigate its impact and protect the health of birds and humans. Avian flu, or avian influenza, is a viral disease affecting birds but can pose significant risks to humans, especially when infected with certain strains such as H5N1 or H7N9. One of the main concerns is the ability of these viruses to mutate and potentially become more transmissible among humans, leading to possible pandemics. Risks to humans include direct infection through close contact with infected birds or through the consumption of contaminated poultry products. Common symptoms of avian flu infection in humans may include high fever, cough, sore throat, shortness of breath, and severe pneumonia. In severe cases, infection can lead to acute respiratory distress, organ failure, and even death. Rapid identification and treatment are crucial, especially as certain strains of avian flu have shown resistance to common antiviral medications. In the United States, while human cases of avian flu are not as common as in other parts of the world, surveillance is constant due to the potential impact on public health. Recently, the emergence of a highly pathogenic avian flu virus subtype has been found in cattle in Texas and Kansas. Additionally, contamination of a dairy worker with avian flu has raised significant alarm and concern about this disease. These incidents underscore the importance of active monitoring and readiness to rapidly respond to any emerging avian flu threat. The relevance of these cases to public health is significant, emphasizing the need for preventive measures such as proper vaccination of poultry and monitoring the health of poultry populations. Furthermore, the ability to promptly diagnose preventive measures and risk mitigation. To protect against avian flu, it is essential to consider effective preventive measures. First and foremost, vaccination is an important strategy, especially for high-risk groups such as farm workers, veterinarians, and those handling birds directly. Always consult a healthcare professional for specific information on the availability and efficacy of avian flu vaccines. In addition to vaccination, rigorous hygiene measures are essential. Always wash hands with soap and water after handling birds or coming into contact with environments where they are present. Avoid touching your face, nose, or mouth before performing this hygiene, thereby reducing the risk of contamination by viruses present in birds or on contaminated surfaces. When dealing with birds or wild birds, take additional precautions. Use appropriate protective equipment such as gloves and masks when in close contact with sick or dead birds. Avoid direct contact with bird feces or secretions and be sure to disinfect any equipment used during handling. If there is suspicion of exposure to avian flu, it is essential to act quickly. Seek medical attention immediately if you experience symptoms such as high fever, cough, difficulty breathing, or other signs of severe respiratory infection after contact with birds. Inform the doctor of your exposure so that appropriate measures can be taken, including tests to diagnose the presence of avian flu virus. Finally, stay informed about avian flu outbreaks in your region or in areas you plan to visit. Follow the guidance of public health authorities and avoid unnecessary contact. Throughout the video, we have explored various crucial aspects related to awareness and prevention of flu and respiratory illnesses. We discussed the importance of recognizing symptoms early and seeking appropriate treatment, as well as adopting preventive measures such as vaccination and healthy habits. It became evident how prevention can significantly reduce the impact of these illnesses on public and individual health. It is essential to emphasize that flu awareness is not only about personal care, but also involves the responsibility of protecting vulnerable groups in our community, such as the elderly and people with chronic medical conditions. Spreading knowledge about prevention is a powerful means of promoting a healthier and more resilient society. Therefore, I invite you to subscribe to this channel and share this valuable knowledge with your friends and family. Together, we can increase awareness of the importance of prevention and create a support network in the fight against seasonal flu and other respiratory illnesses. Each informed person represents another step towards building healthier and protected communities. If you are interested in better protecting yourself against flu and other respiratory illnesses, click on the video that will appear next. It contains detailed information and practical tips to strengthen your immune system and prevent the spread of these illnesses. Together, let's work to ensure that each of us can enjoy a healthy